Welcome to the Deep Dive. This is where we take the sources you've gathered, articles, notes, research, and really get into them.
Yeah, pull out the key insights.
Exactly. So you get up to speed fast, maybe have a few aha moments.
Hopefully.
Today, we're diving into something really critical, AI in emergency medical response.
Specifically how it's helping paramedics before they even reach the hospital. Decision support tools, essentially.
Right, and just to be clear, this whole deep dive comes straight from the source material you provided us.
In that pre-hospital setting, it's incredibly high stakes, isn't it?
No kidding. Every second counts.
Absolutely. You've got paramedics, ambulance crews, they're the first ones on scene, making really tough calls, super fast, under huge pressure, often in pretty chaotic environments.
Okay, that really sets the scene. So, based on these sources, what are the big challenges they face out there?
The sources paint a pretty consistent picture. First off, the environment is just unpredictable, unstructured. Think about traditional dispatch. It's mostly reactive, right? You wait for the 911 call.
Right, waiting for the emergency to happen first.
Exactly. Then, on scene or in the ambulance, they need to make quick diagnostic calls, treatment decisions, but without, the labs and specialists you have right there in a hospital.
That immediate backup isn't there.
Not in the same way. And then there's the challenge of knowing which hospital is actually best equipped and has the capacity, like right now, for the specific patient.
The real-time capacity issue. Is the ER swamped? Do they have a pediatric specialist available? That kind of thing.
Precisely. That's a constant juggle.
So, okay. Real need for faster, smarter decisions in tough spots. How do the sources say AI is stepping in? What's its job here?
The core mission really coming through in the sources is to augment their skills, to give them intelligent help with these challenges.
Okay.
And the sources lay out several key ways AI is being used. Key applications.
Like what? Let's unpack that first one from the outline. Dispatch optimization. How does that work?
Right. So the sources talk about moving towards predictive dispatch. It's more than just waiting for calls.
Predictive.
Well, AI algorithms chew through huge amounts of historical data, past calls, patient demographics, geography, even real-time stuff like big events, weather, traffic jams.
Okay. And why analyze all that? What's the goal?
The goal is to predict, with a certain level of confidence, where emergencies are statistically more likely to pop up in a specific area during a specific time window.
Predicting the next 911 call, almost. That feels futuristic. How do the sources say that actually helps?
It lets dispatch centers be proactive, not just reactive. So instead of ambulances just sitting waiting, they can be strategically positioned, moved closer to these predicted hotspots.
Okay, so they're already nearby when a call comes in from that area.
Exactly. The sources suggest this can seriously cut down response times, shave off crucial minutes.
Which can make all the difference.
Absolutely. Think about, like the sources mentioned, maybe predicting more issues near a big concert or game before a call even comes in. The AI flags it, dispatch stages an ambulance nearby. That's using data to get ahead.
Fascinating. A real shift from reactive to, predictive dispatch. But once they are dispatched, getting there involves traffic, right?
Which brings us neatly to route optimization, another key area in the sources.
Okay.
AI uses real-time traffic feeds, knows about road closures, accidents, even predicts how traffic will flow.
So it's constantly recalculating the best route. It's not just like plunging it into a regular GPS at the start.
Exactly. It's dynamic. It helps avoid those sudden gridlocks, ensures the ambulance is always on the quickest path, whether that's to the patient or to the hospital.
Okay, so AI helps dispatch them smarter, gets them there faster. What about when they're actually with the patient? On scene or in the back of the ambulance?
Right. That's where patient triage and decision support tools come in. The sources definitely spend time on this.
How do those work?
So paramedics can input patient data in real time. Vitals, symptoms they observe, maybe some medical history. They might even upload images or connect readings from medical devices, usually on a rugged tablet or something similar.
And the AI takes that input. Then what? What does it give back?
It crunches that data against huge medical databases using machine learning. And it can offer things like a ranked list of possible diagnoses based on the symptoms entered.
Wow, okay.
It can also flag relevant clinical protocols, suggest treatment steps, maybe even recommend medication dosages based on the patient's condition, maybe their weight.
That sounds incredibly useful under pressure. Did the sources give specific examples?
Yeah, they did. A common one was chest pain. Paramedic puts in the ECG readings, the vitals, describes the symptoms. The AI analyzes it fast and flags, say, a high probability of a heart attack.
Okay.
And based on that, the system might immediately suggest giving aspirin and, crucially, start transmitting that critical data ahead to the chosen hospital while they're still driving.
So the hospital is ready for them, knows what's coming.
Exactly. That pre-arrival notification, that early heads up,
Right.
powered by the AI analysis, it can seriously speed up getting the right care the moment they wheel the patient through the door.
Speeding up diagnosis, getting treatment started sooner, even before the hospital. What about places where getting specialist advice is tough, like rural areas?
That's covered by remote diagnosis support. The sources suggest this is really impactful, especially, like you said, in rural or underserved regions.
How does that work?
Basically, AI-powered telemedicine platforms. They let the paramedics securely connect with specialists, maybe a neurologist for a suspected stroke, or a trauma surgeon if it's a really bad injury.
So it's like bringing the specialist right into the ambulance virtually.
Precisely. The paramedic shares the real-time data, they can talk through the case, maybe even show video, and the specialist provides expert advice on diagnosis, treatment, even helps decide the best place to take them, all remotely.
That feels like a huge leap for access to care.
It really does seem to be. Imagine like a stroke patient way out in the country. Connecting to a neurologist miles away allows for that expert assessment quickly. Maybe they can advise starting clot-busting drugs right then and there, saving brain function. Time that would otherwise be lost just driving to get that consult.
Saves critical time.
Yeah, the sources really emphasize how that improves outcomes. Plus, it helps use limited specialist time better and keeps ambulances available.
Okay, so we've got getting there faster, smarter routes, help on scene, remote expertise. What about the final piece, deciding which hospital to go to?
Absolutely critical, and that's hospital capacity integration, another key application the sources cover.
How does AI help there, instead of just calling around or guessing?
Yeah, historically it might be phone calls or just knowing Hospital X usually handles trauma. These AI systems integrate real-time data feeds from hospitals.
What kind of data?
Things like current bed availability, how busy the emergency department is right now, which specialists are actually on site and available, like is the cath lab open, is the neurosurgeon tied up in surgery, even status of key equipment.
So it stops an ambulance heading to an ER that's already totally overwhelmed, or one that maybe doesn't have the specific specialist needed right then.
Exactly that. The AI system looks at the patient's needs, looks at the real-time hospital status across the region, and then recommends the most appropriate place to go right now.
Which must help the patient get definitive care faster once they arrive.
Yes, and it also helps the whole healthcare system manage its resources better. Smoother flow, less diversion, chaos.
It's really clear from these sources that AI is becoming this powerful toolkit for paramedics. And the core message seems to be, it's not replacing them, right? It's about empowering them.
That's absolutely the critical takeaway, repeatedly emphasized in the sources. AI is a tool. It augments their skills, their judgment. It helps them make faster, more informed decisions when everything's hitting the fan.
Take some of the cognitive load off.
In a way, yes. Handling some data crunching, giving quick access to info or expertise so they can focus more on the patient right in front of them.
What about the difficulties? Implementing these systems sounds, well, complicated. Did the sources talk about the challenges?
Oh yeah, they're definitely candid about the hurdles. There are big infrastructure issues, getting reliable connectivity everywhere, especially outside cities.
The digital divide.
Exactly. Then there's integrating all these different data systems, hospitals, ambulance services. They often have different setups. Getting them to talk to each other smoothly is a huge technical job, and organizational too. Policies, data sharing agreements.
Right. And costs must be a factor.
Cost is definitely mentioned. And something really crucial the sources highlight is training. Paramedics need good training to use these tools effectively, to trust them appropriately, but also know when their gut, their clinical experience might point another way.
Knowing when to lean on the AI and when to override it.
Precisely. It's not just plug and play. The sources stress it needs real collaboration. Tech people, doctors, paramedics, policymakers working together to make it work well.
It's really quite something, though. Seeing how AI is being deployed, often kind of quietly in the background,
Yeah.
to support people in those incredibly critical moments.
It really is, giving that rapid backup to the dedicated folks making life or death calls when every single second matters.
So wrapping up this deep dive into the sources, It seems AI tools are really starting to change the game in pre-hospital care.
Yeah, quite a transformation underway.
We've seen how it's predicting emergencies, optimizing routes, giving decision support right there on scene, connecting crews to specialists miles away.
And helping pick the right hospital based on real-time needs and capacity.
Right. It's all geared towards getting the right care to the right place faster, using data, using algorithms to basically empower those first responders.
Leading to quicker diagnoses, earlier treatment, potentially better outcomes, often making that crucial difference before the hospital doors are even reached.
And it's not just about the tech itself, is it? It's about enhancing the human capability.
That's the heart of it, according to these sources. It's about fundamentally boosting the abilities of the people who form that first vital link in the chain of survival.
Giving them better tools, faster information, quicker access to expertise.
Exactly. Helping build a more resilient, more responsive emergency system overall. It's a pretty powerful example of how technology, when it's applied thoughtfully and collaboratively, can genuinely help save lives, often without us even realizing those complex systems are humming away in the background during an emergency.
Which leaves us with a really interesting final thought from these sources to ponder. Just think about that quiet but immense potential of AI working right alongside our first responders, really changing what's possible in those critical moments long before a patient gets to the hospital. What does that future look like?